Welcome back to MOMnation Unscripted. Now, a word from our sponsor.
Hi, it's Marilyn
and Bruce
of Montage Duo. We are a versatile musical act that performs music from the 1940s to today.
We cover a wide range of musical genres and styles, including classic rock, pop, country, funk, blues, and even a little jazz.
So, if you're looking for professional quality entertainment in the greater Phoenix area, either for an intimate acoustic setting
or a rockin' full band sound, Montage Duo will please you and your guests, engaging them to join in the fun by providing an interactive entertainment experience.
For more information, visit our Facebook page at Montage Duo.
Katie, how are you?
I am doing great, really and truly, on this beautiful Tuesday. It's gorgeous out. Went for a nice walk. There's a lot of people out walking, which I think is
because there's nothing else to do.
I guess that's why.
I mean, yes, you're right. It is beautiful outside. So how was your week this past week?
So lots of exciting stuff over at the house. No, really though. I mean, we're like I have mentioned before, we're doing the best that we can with this. We're, trying to make it fun, especially for our 6-year-old. We have a 6-year-old, by the way, Dani.
Okay.
Hello, Dani, by the way.
Yes.
And just trying to make it fun. This week is all about Easter themes, or Easter themed stuff. So, for art, we're doing Easter coloring, and we're dyeing Easter eggs and doing all that fun stuff. Other than that, it's just really been a whole lot of home, but we're doing it. We're getting outside every day, sometimes twice a day, going for bike rides. Jackson pedaled a couple of times without training wheels yesterday.
Oh, hey. That's exciting. Way to go, Jax.
Yes. So there's progress, right?
Yes. Oh, that's amazing.
Yeah. How about you? How are your kiddos?
They're fine. Jack has been choosing not to sleep because we're still dealing with his concussion. So, that's fun. So did not sleep last night hardly at all. But it's fine. That's why we've got coffee. And I dyed my hair blue. So, I got bored and decided if the world's going to end, I might as well dye my hair the color I always wanted to. So here we are. That's about my whole week because nothing has happened.
Well, it looks like
I'm just wishing that I could have gotten my roots done before social distancing. If we could have just had a little bit more of a heads up on that one, that would have been helpful.
Just a bit, just a little bit. Oh my gosh.
100%.
Yeah.
I'm dealing with it also. You can kind of see the shininess happening here, the grays popping out. So cool thing, Candace Staterly, the uncensored stylist, say that 5 times fast, is amazing, as you know, and she's actually selling these root kits.
Oh,
shut up!
You get the brush. She's an awesome mixer of the hair dye.
Things.
So you get the things.
The magic.
But you get the hair dye all mixed up like she does it, and the brush and some other stuff. I don't know, but I'm probably gonna have to do that because we can't continue to do Zooms like this.
Well, see, I am a terrible human. And the salon was open for one last week before they shut it down. And that's where I went. So it was just me and one other person. I mean, not me and one other person. It was me and the stylist.
Right.
It's literally just the 2 of us in the whole place. So I was less than 10 people. So anyway.
No, I did the same thing, but I did it with my giant golden doodle because I'm I had this true sense they're gonna shut things down and I am not gonna have to be grooming my own giant golden doodle. It's just, I don't want to be quarantined with a smelly dog. So I'm okay, we're gonna just hand her off really quickly, don't touch anything, wash my hands, and get a clean dog. So I get it.
Yeah.
I'm dying right now because I had the same thought. I had mine scheduled because we have the mobile groomer that comes to the house. I had mine scheduled for, I think, next week. And when everything got shut down last week, she messaged me and she's like, I'm really sorry, we're not essential. I'm like, Who says? And let me talk to them because my dog smells so bad.
I don't have a dog, but we're looking at getting one. So I'll know your pain sometime in the next like 9 weeks, probably.
Oh.
But yeah, not yet. Not yet.
So I have to ask you, I've noticed that since the whole virus thing has been happening, like a lot of, maybe it's just because everybody's online now, so I'm seeing posts, but I feel like a lot of people are adopting pets. Is this something that you wanted to do prior to all of this, or are you kind of thinking?
So our doing it actually has like nothing to do with COVID or anything like that.
Mm-hmm.
My son Jack, he is turning 5 on Thursday. He's terrified of dogs. He's absolutely terrified of them. And so anytime a dog doesn't matter if it's the tiniest dog, he just like starts crying and he's like, it scares me. And so I'm like, guess we're getting a dog. So that's the whole plan there. But like at the same time, it's like, okay, well, we don't have anything else to do for the next who knows how long. So we might as well potty train a dog.
Might as well train a puppy, honestly. It's the best.
Everybody's home. It makes a ton of sense.
There's nothing else to do. So
That's literally like one of the best things I've seen about the pandemic so far is these like empty shelters, because so many people are rescuing dogs right now, which is wonderful. I mean, I don't even know if I didn't have a dog to take on walks with me at this point, what would we even do, you know?
Yeah, right. Well, and so with the shelters, we've been looking in the shelters and we cannot find, because we have to have like one of the more hypoallergenic end of the spectrum. Can't find a hypoallergenic dog to any time that there's one that's going into the shelter. It's like gone before it even gets to the shelter.
Maybe you need to be like maybe it's like a lottery, like, you know, when it gets really busy in real estate and you have to get a lottery to get a new build home.
Yeah.
They do that. No, they did that because I was doing the same thing. I was looking for a hypoallergenic one, and they actually did a lottery. And I think 16 people showed up on the day of this lottery to get this golden doodle type dog.
And you won?
Have you ever gone to Pet Finder though? Petfinder.com is like, it's pretty helpful because you can search by certain breeds. So they have like a whole category of poodles. I just think the hypoallergenic issues, so I understand. Yeah.
So we're looking at, there's a lady who has some Havanese that are supposed to be born any day now. So it'd be like 9 weeks before they'd be ready, but they are so cute. Like literally the first time I looked, my husband was like, have you ever looked at Havanese? I was like, no, never heard of that. So he shows me and we're sitting at a restaurant and I just start bawling, looking at how cute this dog is. And he's like, are you seriously crying over this? I'm like, I'm sorry. I don't know what's wrong with me, but this is the cutest dog I've ever seen. So.
Fun.
Yeah. Oh, the days back when we were at restaurants.
It's a distant memory now. Speaking of Dani. Hi.
Welcome.
Can you introduce yourself to everybody for us?
Absolutely, yes. So my name is Dani Stringer. I'm a pediatric nurse practitioner. I've been a pediatric nurse practitioner for about a decade now, and I love taking care of kids. I love empowering moms to be able to better take care of sick kids, especially at home. And so many years ago, I started a blog called KidNurse.org. And it was kind of a play on the name of KidNurse because I am the kid nurse. I'm a pediatric nurse practitioner. And the whole idea was I had moms coming into the pediatric office that I was working at to see me all the time. And the visits would usually start with something like this, like, well, I was reading online and I got really concerned about this. And I just understand how moms in our generation are looking for information online so much, especially about their kids and their child's health. So I thought that the best way to get moms more evidence-based information about pediatric health would be actually just starting a blog and writing about it. And so that's really how KidNurse was born. And we've had millions of people come and read over the years and get education about pediatric healthcare. So that's me.
Okay, I feel like you skipped over a really interesting fact
The
that
really cool part. Yeah.
Katie
Tell us the
told
cool
me. Yeah.
Yeah, so I look young because I am pretty young still. I'm 28. So I actually started college when I was very, very young. And when I graduated with my master's degree, I was still technically 18 years old at the time because I took college classes during high school. And I just was one of those really young kids that knew I wanted to be a nurse. I wanted to help people. So that was just totally my career goal from a very young age. So the kid nurse has a double meaning because I was kind of a kid when I became a nurse too.
I love it.
coolest.
That is the coolest. So we're going to be talking about the medical side of COVID-19 today. And so there's like so much information out there. And I don't feel like, okay, so fun story really quick. Like the other day, I was like, I had a fever and I was like, I can't catch my breath. Like, I think that I have like an exercise-induced asthma. I think that's what it actually is. And so I was like, oh my gosh, what if I have COVID? So I email my doctor and she emails me back on Monday and she's like, if you think you have COVID, go to urgent care. Like, that's an issue.
Right.
But I didn't know what to do, right? Like, yeah, so there are just so many things that for moms, like, we just have no idea what to do. And this is unprecedented. And so, like, what are the basic, like, things like that, you know, as a healthcare practitioner, you think are the things that we automatically would know that we might not?
Right. Oh, there's so much. I mean, it's amazing to be like actually living through pandemic and studying all of this. And so let me start by saying that the thing that I'm most passionate about is evidence-based care. So anything we're talking about is really things I'm referencing from the CDC because I am all about the science, right? So I do want to start with that like trustworthy foundation. The amazing thing being in pediatrics and watching this unfold is typically when we're talking about pandemics and infectious disease outbreaks, they disproportionately affect both the older generation, right, old people, but then they often really affect young children. So that's the part where moms are like, oh my gosh, what's coming? We should be worried about this. You know, a perfect example of this is influenza. We usually see the most deaths in the older population, but then in also children too. They're a lot more susceptible to complications. So it's weird and wonderful at the same time to be sitting in pediatrics and actually be able to come and tell moms this wonderful piece of information that we've had enough time to study from the cases that we've seen in China, at least of the information we know, that coronavirus is really mildly affecting most children in the children that get sick with COVID-19, which is miraculous. So if you're studying the rates of complications like severe morbidity or mortality, so severe complications or death, we're seeing that much more significantly in the population of people over the age of 65 or those that have pre-existing health conditions like lung disease, heart disease. So that's predominantly who COVID-19 is affecting the most. Now, that doesn't mean kids we know obviously can get it. It's just the rate of complications and death is so much smaller. So like the most recent statistics are about 20% of adults that get COVID-19 will need hospitalized care. And from studies that we've seen based off of Chinese children that had COVID-19, it looks like only about 6% needed hospitalization or intense treatment to recover from COVID-19. And thankfully, I mean, though it's still tragic, thankfully there's only been very few documented deaths of children that have died from COVID-19. So I don't know, I just say all of this because I know moms everywhere are looking at their kids and they're like, that first time they cough, it's like, oh my God, here it is, you know?
Right.
What are we gonna do?
Right.
And I would just say in all of those situations, take a deep breath. We face viruses all the time. So we do need to be really vigilant about following CDC guidelines and socially distancing. But I as a nurse practitioner, kind of think like worst case scenario. And worst case scenario in this situation, if you are faced with fighting through COVID-19 and your child does get sick, it's usually pretty mild.
That is so comforting. Thank you so much. Seriously, that, because when we'll talk about it later, I'm sure, but there's so much information coming at us from all sorts of different directions that it's hard to sift out sometime, and especially when you are a bit panicked. So what are the signs that our moms should be looking for that say, oh, hey, it's time to go to the ER? Like, this is a serious thing. Where do they decide that?
Yeah. So we know COVID-19 is a respiratory infection. So the most predominant symptoms that we're seeing in both adults and children starts with coughing. And then in severe cases, it progresses to respiratory distress. So I've done a lot of work on this at KidNurse.org. We have a really detailed blog that teaches parents exactly what respiratory distress looks like. I do this a lot in the Mom Nurse Academy too, which is our new online course. And we have a whole module dedicated to teaching parents what respiratory distress looks like. But really, because this is a virus, you need to be concerned like for the same reasons that you would be concerned about RSV or influenza. And we see the progression of symptoms, but specifically with COVID-19, if your child has coughing that's progressing to the point that they're having any type of difficulty breathing, then that's when you as a mom need to take urgent action and get them into the emergency room.
So we talked a bit about looking for information. And when moms come into your office, the first thing they say is, well, I was reading online and I Googled this. And so
right.
what is your advice for moms going forward, like COVID-19 or not? Like where do we get our information? It's sometimes not possible for us to always be on the phone calling,
absolutely,
your pediatrician. So
right.
What do we rely on?
Right. Yeah. So I just did, in case your viewers are interested, they can go to KidNurse.org. And I did a whole masterclass about this, and it's specifically about COVID-19. So it goes in a little bit more details of what we're talking about here, but it's also all about how to avoid misinformation online. And this, to me, really goes back to understanding what evidence-based care is. What are the scientific foundations for looking for advice that we need to, get good advice about our kids? And it's so true. You don't want to call your pediatrician every single time you have a question pop into your head. So we have tons of resources at KidNurse.org where really what I try to do is just break down the research and make it very easy to understand the science and what's applicable to your family and your situation. So I do this a lot in the Mom Nurse Academy too, our online course. And then we have actually a whole private Facebook group that I run, and it's also run by tons of my amazing pediatric nurse and nurse practitioner friends, where we give parents answers to that have enrolled in the Mom Nurse Academy. So we're trying really hard through our KidNurse resources to get parents the information that they need. But honestly, it's hard and it's confusing, and parents need to be really wise about looking at the information they're seeing and looking what you're scrolling through on Facebook and looking through, what's popping up on Instagram, and really ask yourself, what are the references on this? Is this mom talking about her experience, or is she talking about what we know in scientific literature? So it's a lot of critical thinking, but I do talk about this more in that webinar too, in case your listeners are interested in more, because I understand it's like a sea of misinformation out there.
Yeah, well, if you go and you Google just what are the early symptoms, there's literally no information out there. Normally, if I was to what are the early symptoms of pregnancy? What are the early symptoms of this? I could go and I create 5,000 people's experiences with it.
Right.
With this, there's nothing.
Yeah.
Nobody.
Specifically too, if you have COVID-19 questions, obviously the CDC is going to be the place to go with. But I forget exactly the epidemiologist that was saying this in regards to COVID-19, but he was we're trying to fly the plane while building it. And that's the hard thing about any new disease, right? we're doing the best we can with the information that we have. So like if you're listening to anybody's advice over this, everybody needs to be transparent and saying, well, there's a lot we don't know yet. But at least I can come to moms and say, well, we have a small study of 2,000 kids in China that got COVID-19, and 90% of them had asymptomatic to mild to moderate disease, and they all recovered at home. So, you know, your chances are really good that you'll be empowered to still take care of your child at home, and they won't develop severe complications.
So how do you take care of your child at home if this is the case?
Yes, yeah. So usually, the symptoms that you're going to see are really going to mimic any type of upper respiratory infection. So usually you're going to see some runny nose, you're going to see coughing, your child might have a little bit of a sore throat. There have been some cases reported that in certain kids that have some GI symptoms like stomach upset, nausea, vomiting, though that's more rare. It's really more commonly upper respiratory infections. Oh, and then obviously too, about 50 to 80% of the kids tend to get fever. So fever is definitely a sign that goes along with COVID-19. And so because these are viral symptoms, because there is no cure, the treatment at home is supportive care. So, you know, we use Tylenol or ibuprofen if your child's severely discomfortable or uncomfortable. We encourage rest. We encourage lots of fluids. Really, if anybody's sick in your household, if you can try to quarantine them to one part of the house so the rest of your family doesn't get sick, that's awesome. Washing your house, cleaning your house as much as possible. You know, like a lot of those kind of basic things. But I understand even in like, I just sympathize with moms right now because we're very like not wanting to go to our pediatrician, right? We don't want to go in there if at all possible.
Yeah.
So honestly, this is why, I mean, I've been working on this new course, the Mom Nurse Academy, for the past 8 months. And so this was like, the goal of this was to take KidNurse to the next level because there's only so much I can teach a mom in one blog post, right? So what we did with the Academy is I teach on a whole bunch of common issues that every mom is going to face with her sick little one at one point or another. So we talk about fevers, we talk about colds, ear infections, sinus infections, respiratory distress, and dehydration. And it's like a deep dive video modules. It's you and me, and we sit in my living room. And when I was writing the curriculum for this, I asked myself, if I had unlimited time to teach moms everything I wanted to back when I was in my exam room, this is what I would teach you. Because most of these things you are going to face are viruses, and that means that you can't handle it at home. But of course there are red flags that you need to be aware about, and when should you give your Tylenol, and when should you skip it, and there's all those questions that we really go into more details about in the Academy, because it's just a platform that I could really teach parents all the evidence-based info that they need.
I have a couple of questions out of all that.
Yeah.
The first one is there anything that you recommend to clean the house with? Like, does it need to be Lysol? Does it need to be bleach? Does it need to be alcohol? Like what?
Really good question. So the bummer news when researchers looked at this, like they actually took coronavirus and they spread it on different types of like things like plastic and metal, and they studied it and they saw how long it could live for. And so we know that especially on like countertops and plastics and metal surfaces, coronavirus can live up to 2 to 3 days. So that's like,
oh, gross.
It's really a bummer. It's pretty hardy.
Yeah.
It's also why you don't want to be taking your kids to the playground right now, you know, because these things can live on surfaces for a long time. So I'm cleaning my house with bleach. Bleach works really, really well. Any type of alcohol solution, so like if you're using even hand sanitizer, it needs to have at least 60% alcohol in it or higher, or it won't do the trick. You know, like there were all those things floating around about how you can make vodka hand sanitizer, and it's not going to cut it unless it's 60% or greater alcohol content. So that's true with any of your cleaning products. So bleach is really great. There's one, unique thing that we know about coronavirus and the actual way the virus is made. It's like enveloped by this bubbly oil solution, and it does break down really well with soap and water. So that's why the CDC keeps talking about like how we need to be really vigilant, to be washing our hands with soap and water, and to be doing it for 20 seconds. So we've all been to the store, and you look in the cleaning aisle, it's the cleaning solution aisle, and there's like nothing, right? So it's really a bummer if you don't have anything on hand. So I say that because there is some hope that even if you don't have bleach or things that are heavily concentrated with alcohol, even if you're working with soap and water, there is some hope that that would work. But really, like, just be cleaning all of these common surfaces at least once a day if you can. So think of like the main surfaces in your house, like your kitchen counters, bathrooms, light switches, any place anyone is commonly touching, or any place your kids are commonly playing at. Think of cleaning those surface areas.
So I've seen some people on Facebook like cleaning their groceries before they bring them in the house. What are your thoughts on that?
Yes. So in all of this, we have to like examine risk, right? And we know right now, because social distancing is so important, we're going to have the greatest amount of risk when we go to areas that are where people are congregating. So really, if you're practicing good social distancing, if you're able to work from home, your time of greatest risk is when you're going to Walmart or Costco and everybody's in there touching things. So if you really do want to be super vigilant about reducing risk, then I totally understand why families are wiping down products and cleaning products. That is going to reduce your risk the most. I think something that's a little bit easier, if it's not a cold product, if it's not like milk or eggs or something that needs to be refrigerated right away, if you're not going to need that food for 2 to 3 days, and hoping the Arizona weather stays pretty good on us, you can honestly just leave those other products either in the garage or in the car for 2 to 3 days. So if you're leaving that in there and you don't need it urgently, then any type of, let's say, worst case scenario, somebody with coronavirus wiped their hands all over it, that virus is going to be dead by the time you're bringing it into your house. So that's another more practical solution if you don't have a lot of cleaning chemicals on hand.
And what about like produce? Like, how do we, because somebody could have touched my apple, right? Like,
right. Yeah.
And I don't want to rub it with bleach. So.
No, you don't want to. I know there are like some fruit scrubs, or even again, if you think of it like your hands and you want to just wash it with soap and water, that's going to reduce your risk the most. But, you know, even if you want to consider switching from apples to oranges for a little while, or bananas, and you peel it off, again, that's another nice way to reduce risk.
Okay, Mom, if you're listening, you're not crazy for washing your groceries. Sorry.
She literally commented. She commented. She said, I clean my groceries before I put them away.
My mom's a nurse, and I always tease her because she's extra careful all of the time. And so, yes, Mom. Sorry, Mom. I'll clean my groceries from now on, Mom. And
my mom's doing it too. And some of these things feel so weird because they're just unnatural, right?
It's true.
And like, you know, then if we really go into the rabbit hole, it's like, well, should we be ordering food into the house still? And it's hard because I want to support local business, and my husband loves Mexican food, you know, like, so these are kind of difficult things, and we have to analyze risk and really think about who is in your household. Are we talking about little infants? Are you immune compromised? Do you live with people that are over the age of 65? You want to be as socially responsible as possible, but then also practically reduce risk at the same time. Does that make sense?
100%. And I had heard that it's the rubbing and the sudsing. So that's why you want to do it for 20 seconds. So it's that sudsing that breaks down that fat barrier around, where the virus is kind of kept in. So is that accurate?
Yeah, it's the component of the soap. So any type of soap itself is going to attach to that oily lipid molecule. So the sudsing is just it's a reaction of the actual rubbing. But the main point is you want soap to touch all the areas of your hands, front and back, and you want to really take a moment to try to break that down and get it off. So that's the science behind it.
So we had a comment where Amber Cross just said, "Welcome to a germaphobe's life." And, you know, as we're talking about this, like, how do we make sure for our kids that we're setting our kids up to not like be germaphobes
Right.
after this is over?
Yeah. That's a great question. And I think it's fair to say that none of us have faced a pandemic of this scale in our lifetimes, right? So it's really insane that we're now seeing a place when it's literally, we're like sheltering in place and we're in our homes trying to protect our families. So it's hard to know how that's going to affect kids, except for we do know that kids are really resilient. I do think that most kids are going to walk away from this experience thinking, wow, wasn't it wonderful that we got to play at home for hours and hours and hours, and the weather was beautiful outside and we saw mom and dad. And so I think most kids are going to walk away from this experience, hopefully with fond memories, because it is a unique time to spend time with your kids. But, you know, I do think, and we've seen this throughout time and history, that when we face pandemics, there's ramifications of that and people change. And so I think being honest with your kids and having science-based conversations about why we're doing the things we're doing. Well, why is mom wiping down groceries right now? Why are we staying inside? You know, that does help little minds process big problems, just like all of us are doing.
Yeah, valid question though, Beth. That's a good one. So back to groceries real quick.
Yeah.
Is there anything that you suggest that moms should be certain that their children are getting in terms of nutrition, in terms of immunity boosters? Should they be on a multivitamin? Like, let's talk about all that.
Yeah, great question. So we want healthy and balanced food for kids, just like we always want healthy and balanced food for kids. I am not the cook in our family, so I have absolutely no advice for cooking these beautiful things, though I'm like really impressed with my friends because I feel like a lot of people are connecting with their inner cook. And I'm just over here making chocolate chip cookies and comfort food. So I'm saying I'm not a good example of that, but I'm really impressed by people that are taking extra time and cooking these beautiful things. So nothing about what you're feeding your child should change as opposed to life before this pandemic. So we got fruits and veggies and all the healthy things that we are hopefully ordinarily giving your children. The American Academy of Pediatrics really doesn't recommend multivitamins because in a child that's getting a balanced, healthy meal, if they're eating well, the research has shown that kids really don't need extra supplemental vitamins, apart from infants under 1 who we do supplement with vitamin D. So apart from that, if you're getting balanced nutrition, kids really, there's just not enough efficacy to say, yes, all kids need to be on a multivitamin. Now, that being said, I know obviously lots of parents feel like, well, you know, day to day our diet kind of changes, and so that's unpredictable based off of your toddler. So I just feel better giving my child a multivitamin. That's fine, you know. It's but I never want parents feeling like, because sometimes they are expensive. I never want parents feeling like you have to go rushing out to buy multivitamins, because there's a really good reason why the American Academy of Pediatrics says that you don't have to do that. So does that kind of help? There's really, like just with any type of virus, there's a lot of misconceptions about what we do to boost our immunity. Really, the basics have the most science behind them. Get good sleep at night, wash your hands well, eat healthy food. You know, those are the things that support your immune system the most. And kids have an amazing immune system naturally. That's what I focus a lot about teaching on in KidNurse and our MOMnurse Academy. Like, your child's immune system is amazing just the way they are. And that's how they usually kick all of these viruses really on their own with enough time to sleep and recover.
Absolutely. And I love that answer. Thank you very much. I'm a firm believer in nutrition as well, and not relying on the multivitamin to be the nutrition source.
Yeah.
And I think that can be easy to do. I mean, I get it. Life is busy. You get busy. Maybe you have multiple kids and you're juggling lots of stuff. I totally get it, but I think it's important. So thank you. Yeah. So we talked about best practices. We talked about kind of things to look out for, you know, as far as deciding whether or not that you should go to the ER. But what are the most important facts and what should moms steer clear of? I mean, we talked about, making sure you get the real news and the real evidence-based science. Is there anything else that you can speak to there?
I think for me, the biggest takeaway that I would want a mom hearing is treat mild symptoms at home. So I don't want you to panic every time you see a sniffle or a cough. You're going to treat all these mild cold symptoms, all these mild viral symptoms the exact same way, right? So if your child is mildly ill, honestly, it doesn't even matter if it's COVID-19. Like, we know that testing is a huge problem. Most people don't have access to it. Depends on your local epidemiology. Usually they're preserving tests for the sickest of sick patients. So there's really, I don't want to create that panic, because we don't want to overrun medical facilities and institutions.
Right.
So it's really unnecessary in most cases to go rushing off to the ER. And I think the public is really starting to understand that, which is great. And even if you are seeing illness symptoms at home, I'd also really encourage moms to be sure to call your pediatrician before you just go in. Most pediatric offices have new policies in place and how they're trying to prevent infection as well. So really, if you can treat at home, get support over the phone, call your pediatrician before you go in, that's totally crucial as well. And thankfully, as long as moms are following other guidelines really well, practicing social distancing, keeping your kids at home, washing hands really well, cleaning as much as you can, staying away from other people, you're going to be doing everything that you can to protect your family. And you can have at least confidence at the end of the day that you're doing the best you can. And even in the worst case scenario, in regards to children, it's usually a mild course of illness.
So I don't know if this is a thing. Let's talk about that first. So is there a certain level of, in your experience, mother's intuition? Okay, we've all talked about mother's intuition, right? So is there a certain level of that moms should trust? I feel like when we're faced with uncertain times, we don't necessarily trust our gut instincts. And I can tell you a little story. I won't get into all of the medical details and facts, but I had, when my son was first born, he was born with a singular kidney. Like, he doesn't have the plumbing or any remnants of this other kidney that exists anywhere in his body. And so he was just a couple of weeks old, and the pediatrician had suggested going to Phoenix Children's, getting some regular testing done, whatever. The routine testing on my 3-week-old baby, 4-week-old baby, to me seemed rather invasive, and mother's intuition was going crazy. Mm-hmm. And everybody was like, you should just follow what the pediatrician's saying, just go get the test. And I'm like, no, it's going to harm my baby. Long story short, a year and a half later, I'm talking with one of the senior advisors in the urology section, and I don't know all the medical terms, sorry, in the Phoenix Children's Hospital. Yeah. And the first thing that he did, we were doing a checkup for some things, and the first thing that he did was walk into the room and shake my hand and say, Mom, I read your chart. I see that you refused these tests. It was like VCG or something. I don't know. I won't even remember, but you refused these tests back when he was just a couple of weeks old. Good on you, because that could have caused some damage to him. So I then, from that, of course, I was freaked out for like a year and a half. But from that, I learned that mother's intuition's a thing. It's a thing for me anyway. Mm-hmm. In your experience, I mean, do you come across that?
I think that, the way I practice care and the way all of the respect-worthy other pediatric providers I know practice care is that we always, I give my parents everything when I'm listening to them, right? So mothers do know their children best, right? As a mother, you're going to be able to tell me what symptoms are really out of the ordinary for your child. And so as a mom, you do need to feel listened to. Now, I will say, though, when it comes to intuition, so much of what we're talking about with intuition is emotionally driven, right? There is no connection in the whole world like the emotions that happen between a mother and her child, right? And your family members. So I think about it this way, too. It is not medically advisable for me to treat my own family. right? And most nurses and nurse practitioners will just, we all have a bunch of stories. Like, this is a fantastic story. My husband and I were in a snowmobile accident. He ended up breaking his back, and then he ended up breaking his face, and he needed facial reconstruction surgery. So we were already multiple surgeries in, well down the line. It was an absolute nightmare. And so after he had his facial reconstructive surgery, a few days into it, his face started swelling so much. And I don't know if it was a mixture of emotions or exhaustion, but if you get to a certain point when your emotional response can't analyze all of the physical assessment, and you can't analyze all of the evidence-based care. And I kept telling myself and telling him, oh, it's just delayed inflammation. It's just delayed. I'm sure you're just a little too sore from surgery. And what it ended up being was a very serious facial infection where he had to be re-hospitalized again for days to get over it. I mean, it could have been life-threatening. Wow. And at this point, I already had a master's degree. I'd taken care of lots of patients. But I share that experience to say sometimes our emotions block our ability to fully assess everything, right? And so that's when you need to partner with your child's pediatric provider. Mm-hmm. And so you always want that person to feel like they're truly listening to you, but then you also have to have a trusting relationship that still says, like, I'm coming to you because I respect that you know what the evidence-based guidelines are for children. And then this is why you decided to specialize in this. And having another set of eyes that are not emotionally connected the same way you are is critically important in getting children the right care.
Awesome. Very thorough. Thank you.
So here's a fun devil's advocate kind of question.
Yeah.
So you mentioned that you should look at your pediatric provider as somebody that you really trust, that you can partner with, that you can work in that way. Yeah. I would argue that many moms that I've talked to, they don't feel that way about their pediatrician. Yeah. So what should they do?
That's a great question. I don't want to be the person standing up here saying, well, you should get a second opinion, but I feel like it's important to give people a time to build relationships. So for example, I want people coming to KidNurse, I want them to pretty immediately see that I am dedicated to science and evidence-based practice, that I've given my life to this, and that as a part of my methodology, I believe you can believe in all those things and be really kind to people going through difficult experiences. That's just the way Dani is wired if you're coming to me looking for care. And so of the pediatric providers I know, most of them are totally on board with that. That is how they operate. I would say sometimes our medical system is set up in a broken way that we get 5-minute interactions with people. Yeah. And it is really unbelievably hard for any mom to feel fully listened to and heard when you're given 5 minutes. And that's just, it's a problem with our medical field. This is literally what kind of prompted me to write the course that I did, because I can't reassure any mom of all her fears about her child's fever in 5 minutes. It's not going to happen. So this mom's going to go home and still be worried because something new is going to happen, and they don't know if they should ask their mom about it or post on Facebook, because then you're going back through the whole how do we sort good information game. And you don't also want to be that mom having to call your pediatrician in the middle of the night because you're not sure that it's warranted. So when I sat down and I wrote about fever education, it took me an hour to film it all, because there's actually a lot that moms should know about fevers, and it's going to happen to your child many, many times. So it's hard to fix problems with systems that are just kind of broken. Like, it doesn't always work super well. That doesn't change the fact that moms should feel listened to and they should feel supported. And I think that most pediatric providers typically do get it right. But it does take time to build that trust with anybody or any relationship in medicine.
Speaking of fever, a lot of stores keep getting sold out of Tylenol. They keep getting sold out of everything that we can use to deal with fever. This actually happened to me right after everything went crazy. I was in Utah, every single shelf is cleared off. So my kid had a fever of like 104. What am I supposed to do? Like,
Right.
so what can moms do with that in particular, with the fact that we don't have access to the medicines we used to have?
Yeah, usually, so that's one good thing. Like if you have to be out of something, you never want your child to be uncomfortable. But I always help moms through what we call fever phobia. And it's that fear that you feel. Everybody feels it. When you touch your child and they're warm and it's the middle of the night and you're like, oh my gosh, what do we do? That is fever phobia. So when I walk people through teaching them about fevers, we start with how your child's immune system works and how your child's body is wired to get a fever. And we know that fever actually helps them fight the infection. So that's what the fevers are all about. And so we've actually learned by studying many different diseases that if you don't suppress that fever with medications, if you just kind of let it do its thing and we help keep that child as comfortable as possible, often the length and severity of illness is shortened by not treating. So this is why the main takeaway point on fevers that I want all moms to understand is that we treat your child when they're uncomfortable. We don't treat numbers that we read on a thermometer to a certain extent. I mean, if your child is 104 or 105 degrees, they're going to be uncomfortable, right? It's just that goes hand in hand. So we then treat them. But usually, there's tons of times when your kid, I'll see this and I've seen this in practice a million times when they're still like 102 and somehow they're running races around the pediatric office. Everybody responds a little bit different to fevers. And that's why we treat true discomfort. We don't necessarily treat numbers. So there is a major issue of over-medicating generally because we're so programmed to do it. It's a cultural thing. Our parents did it for us. This is just what you do, and you make that fever go away. But really, that's not the best. And so that's what we work a lot on in trying to help parents get over fever phobia so they can confidently know, okay, what do we do in these situations then? And so that's even how the name MOMnurse came about, because with the MOMnurse Academy, moms are the ones that are actually taking care of their kids at home, right? You're the ones in these situations that like have to make the next decision move. Like, do you treat? Do you call the pediatrician? Do you post on Facebook? What do you do? Do you put them in the bathtub? Do they drink water? And so the whole goal of that program is to try and get moms the evidence-based information they need so they can start thinking a little bit more like a nurse in these situations because they've been given access to those tools. But Tylenol like comes back and is normal because all of the stores being out of everything is very unnerving.
It is. It's creepy.
Yes.
Weird. Really weird.
All right. So, Beth, this is episode 8.
It is.
Yes. And on episode 8, what do we want to ask our audience to do?
Well, we want to ask them to rate, review, and subscribe on your favorite podcasting platform, especially iTunes, because that's where most people will see us. If you go leave us an amazing 5-star review there, we can get more of this information to lots of moms like you. And we cannot do that without you guys leaving those ratings and leaving those reviews so that other people trust us and know that moms like you, you think that we're bringing really great information to you. So please, please, please leave us a review. Please rate us, please subscribe, and download these episodes. Because if you don't download them, it doesn't count. So,
right. So help us help you and help us bring more wonderful people like Dani to you to give you all of this awesome information. I can't wait to watch the replay because there's lots of things
so much good information.
Yes.
Yeah.
So with MOMnurse, let's just make that real clear for our audience here. So this is a course that you're offering through your blog, right?
Yes. So it's an online course. It's tons of video content on me teaching you how to confidently take care of your sick little one at home. And I'm running a special deal right now. So if you run, and it's specifically for your viewers. So if you go over to KidNurse.org, it's KidNurse.org/academy. And on that page, I tell you all about what you'll learn and the group you'll be a part of, and so you can confidently do this. I feel like it's more important now than ever. But if you use the coupon code during checkout, MOMnation, then I'm taking $100 off the course for you guys. So go check it out.
Yeah, that is awesome, Dani. Thank you so much. I so appreciate that. And I will link that because you sent me that. So I'll link your page in the show notes so that people can link to that very quickly. Otherwise, if anybody has any questions, wants to get in touch with you, it's cool to just message you through KidNurse on Facebook.
Absolutely. Yep. KidNurse on Facebook or at kidnurse.org, our blog. We have a whole contact us page, and we'd love for you to get to know us better there.
Awesome.
Amazing.
Cool. Well, thank you again, Dani. Thank you to my beautiful co-hostess, Beth, with your gorgeous blue hair. I'm in love with it.
Right? So fun. This was such a great episode, Dani. Thank you so much.
Thanks,
So
Beth.
good.
Thanks, Katie. I really appreciate that, guys. I hope this was helpful.
Totally. All right, guys.
Okay, see you
Until next
week.
time.
Bye.
Bye.